Hi, I'm Dr. Peter Coleman. I'm a retired physician, addiction medicine specialist, and I had the pleasure of working with patients with opioid use disorder for over 40 years. Today, we're going to be talking about how drugs and the disease of addiction changes the emotion circuits in the brain. Remember that the first emotion circuit that gets affected by drugs is the falling in love. We literally fall in love with drugs, just like people fall in love in a romantic sense. We get a strong dopamine spike in the reward system, then the emotion circuits get activated, and we find ourselves thinking about that drug, thinking about how good it was over and over, obsessing about it, having cravings about it, thinking about when we're going to have it again, missing it when it's not there. And in particular, ignoring red flags, kind of like a bad boyfriend or girlfriend. You know they're bad for us, but we ignore it. We pretend that it's not that bad. We tell ourselves, we'll quit tomorrow, we'll cut back later, it's not that bad. Amazing how that process goes on because we love that feeling so much and our brain has been so affected by that. Just like people having an affair, it often takes something dramatic to break them out of that. Sometimes in a romantic love, the wife deciding I'm leaving and taking the kids before the husband goes, oh, I need to change. Same thing with drug addiction. So often it's a drug overdose or it might be a spell in jail. Time in jail can actually be incredibly helpful because it's a dramatic thing. You can't deny it. And it gives time for the brain to heal and start seeing things more realistically so that the other parts of the brain can all heal. The second part that gets damaged is that drugs numb our emotions. They're really powerful at numbing our emotions, and that feels good in the moment, but it doesn't help us long term. Emotions are kind of painful. Sadness and jealousy and anger are painful, sort of like physical pain. And when we think about physical pain, it's essential to have it, even though we don't like to have it. A friend of mine had really bad diabetes, and he ended up having swollen ankle. And when he went to the doctor, they took x-rays and they found out his whole ankle was obliterated. He had what's called a Charcot joint, and he had no feeling in his legs, so he couldn't feel any pain, which we would all think, oh, that's a good thing. But in reality, every time he hit the ground, he hit it a little bit harder than a normal person who does feel pain. And so over weeks and months and years, he started damaging that ankle joint to the point of it being so damaged, the doctor said, we're going to have to amputate your leg. So none of us want to feel pain, but it turns out that pain is actually really good for us. We need it to make good decisions. A patient of mine, Patrice, is a good example. She was addicted to fentanyl, and she was living with her boyfriend who was a fentanyl dealer. So she had plenty of it. She didn't have to do anything. She ended up sitting around the house all day, not doing anything, just getting high. She had so much of the drug, and a normal person in that situation would have done something about that. They would have been angry, they would have been sad, they would have been lonely, but she was just so numb. And she just had no ability to know what she was feeling, and so she didn't change anything. Fortunately, the police came one day and arrested the boyfriend, and she ended up getting into a methadone program, and she started doing really well. So we need our feelings, even though we don't like them, but they're really essential. There's a saying on a plaque on a wall of a treatment center I went to once that said, you can't heal what you can't feel, and you can't feel what you medicate. So when we take drugs, they medicate our feelings. We don't feel them anymore, so we don't heal, we don't change. In recovery, we need to learn what our feelings are. We need to start identifying them, and there's another chapter on how to do that better, so that we can then understand why we're having them, and then we can change the things that we don't like doing. We can start learning and growing. We need to start looking at our friends, at our feelings as our friends. When we feel anxious, we need to start having the attitude, oh boy, I'm anxious. I'm really scared about something. I wonder what that is. I'm so glad that I'm feeling that so that I can then fix it. You know, I can change something, and then I can heal, and then I can move on.